News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today we're going to be talking about a topic that's very important to our community, and that is what is going on with supposedly very simple cosmetic procedures. There have been several complaints filed to the Nevada State Board of Nursing by people who have been placed in harm's way when they have undergone these supposedly simple cosmetic procedures. So we're going to be examining that today. And we have a great expert guest with us today. Our guest is Deborah Scott, who is the Executive Director of the Nevada State Board of Nursing. Deborah has been involved in nursing regulation for over 15 years and has been also involved in psychiatric administration as well as in private practice. And Deborah, it's so great to have you here at the show. Thank you for coming to share your wisdom with us today.
Thank you for inviting me.
All right. So Deborah, I guess kind of a global question is, what type of procedures are we talking about? What concerns do we have?
Well, a title that has been, that these agencies have been given at this point is as medical spa. And that gives people a sense of security, I think, because of the name medical.
Yeah.
But what we're looking at is we're looking at relatively non-intrusive kind of procedures. They are incisionless. They provide minimal discomfort. They create little or no skin wound, and they must be performed in less than an hour. So they are simple procedures. But the types of things we're talking about are Botox injections, Restylane, other fillers. There's a new one called Dysport, medical microdermabrasion, laser hair removal, laser resurfacing of skin, intense pulse light treatments. Even some facilities are offering mesotherapy. They're offering liposuction, and then they are dispensing drugs as in HCG for weight loss and Latisse for having your eyelashes grow longer.
Wow.
Yeah.
So there's a lot going on at these so-called med spas and these so-called simple procedures, but there have been complaints that were filed where people have been harmed.
Yes.
Can you tell us then, what are the concerns? What's happening in these places? And how is this happening?
Yeah, it's happening based on people who are not necessarily licensed or certified or not competent to do these kind of procedures. And there is no oversight of these types of facilities. They aren't licensed by any regulatory body. They have a business license, and that's it.
So Deborah, someone can just say that they've got a med spa and they have these types of, like Botox and other procedures, and just come and have this done, but they're really not being regulated, and what, their employees aren't adequately licensed or certified, or oversight, or how would you describe that?
Well, the hope is that if you have a medical spa, that you have someone who has a medical license who is in charge and supervising.
Yes.
In fact, the association that is a national association for med spas has a definition that includes that there must be a doctor on site. So oftentimes that's not the case. And that's when people get in trouble, because there isn't oversight of what's happening with nurses and or estheticians and maybe even medical assistants or techs. So
people are really doing things without supervision, and they're doing things that they're really not trained to do.
Absolutely.
Yeah, and so that makes it dangerous.
Yes.
So it's really like buyer beware. The patient or the customer is really at risk when they go to these places. And of course, we would think that they probably are licensed and regulated and everything's fine and above board, but I guess it's not all the time, huh?
No, and I think people don't really know the right questions to ask. And so part of my being here is to make sure that people understand what they need to ask and what they need to look for to be safe.
You know, so there are 5 questions that people need to ask. But before we get to those 5 questions, we've only got about a half a minute in this particular segment. So you're saying, though, Deborah, that people should be very cautious, and I guess that they should take the initiative and really check these places out and the people out as well, huh?
Yes, and we have resources now that are available to us, and so we'll talk a little bit about those resources and where you can go for that information.
Okay. And so right after this brief break, we're going to take a look at those resources and those 5 questions that Deborah has that you'll want to ask if you're interested in these simple cosmetic procedures. Hello, and welcome back to New Skills for Living. You'll see up on your screen the website, easeap.com. And on that website, you'll be able to view Deborah's interview, as well as all the other interviews we've had in terms of addiction recovery and acceptance and commitment therapy. So go to that website to, in the future, watch Deborah's interview. And then also, I wanted to remind you that there are over 80 newsletters that are up on the website dealing with gratitude, anxiety, stress, depression, addiction recovery, communication, family relationships, and you can pull these up and read these or copy them or send them to family and friends up on the easeap.com website. So we want to move back now to talking with Deborah Scott from the Nevada State Board of Nursing. And Deborah, we were talking during the break that this non-regulation of these medical spas is similar, it sounds to me, like the non-regulation that we saw earlier in the year, where people were selling spice and bath salts and people were buying them for drugs and hallucinating and ending up harming themselves and ending up in emergency rooms because they weren't regulated. It's the same way with these med spas, that they're not regulated.
Yes, and when there's a market,
yes,
people will find a way to get those kind of things to the consumer.
And if people have a storefront and a fancy name, or they're off in the country somewhere and they have a fancy name, people assume that it's regulated and it's safe, but it's just not, huh?
Yeah. In Nevada, med spas are not regulated. That's why it's important to make sure that when you look for a med spa, you look for someone, for instance, a med spa that is affiliated or is part of a physician's office, because in that way, then you have some protection.
Yes. Now, is because of course the physician knows how to practice, and there's liability insurance and all kinds of things.
And he's licensed.
Yes, and he's licensed to do that work.
Yeah.
So, Deborah, you were saying you had 5 questions that you would suggest our viewers use when they're interviewing a med spa.
Yeah. The first question that you really need to ask is, who owns and operates the med spa? Mm-hmm. You know, is it owned by a physician? Because the International Medical Spa Association says that med spas are to be supervised, owned, and supervised by a physician.
I see.
So it would be important to ask that question. And if it is owned by a physician, what's the doctor's name? Mm-hmm. So you can look that doctor up on the Board of Medical Examiners website.
And if someone goes to the Board of Medical Examiners website, it'll say whether or not there have been any complaints or any concerns with that physician?
Yeah, if there's discipline or anything like that.
Okay.
Yeah. And then the other question is, related to that question, is the doctor on site? We had one complaint where the doctor actually was in another state.
Oh, gosh.
So never really did darken the door.
Yeah.
Didn't own and was out of state.
So supervision in name only, not in really making sure that patients or customers were safe, huh?
So make sure the doctor's on site.
Uh-huh.
Yeah.
Okay.
Yeah. Then the second question is, who will be performing your procedure? You really need to know who that person is. What's the licensing of that person? Is that person someone who is authorized to do injections? There really are, are they trained? Are they certified? Is there a license that's necessary for them to do the procedure that you're going to have? The third question is, what kind of equipment do they use? This equipment is very expensive equipment, which is why you will pay a lot of money for these procedures. But do they keep are those, is that machinery or that equipment serviced on a regular basis? Is it relatively new equipment?
Which is kind of like the concern of what happened in Las Vegas, where there was equipment that was being used and it wasn't being maintained and cleaned correctly, and all kinds of people ended up getting infected.
Yes.
Yes, okay.
Yeah, so make sure that that's happening and make sure that it's being cleaned on a regular basis. And then the fourth question is, you really want to be smart about the pharmaceuticals or the medications that are being used at this med spa. And there are certain things that are being used that you need to make sure that you need a prescription for. For instance, Botox. You must have a prescription to get Botox.
And that would be from a physician?
It would need to be a physician or an advanced practitioner of nursing or a PA.
I see, okay.
And so if you are going to be getting Botox, then there needs to be some kind of an assessment, evaluation by one of those three practitioners.
Now, time has gone so fast we haven't gotten through all the questions in this segment, and so we'll take a brief break, and after this break we'll continue talking with Deborah about the questions. Hello and welcome back to New Skills for Living. We're talking with the Executive Director of the Nevada State Board of Nursing, Deborah Scott, about concerns that you as consumers should have about med spas and the types of questions to ask. And Deborah, you were just going to get to another question that customers or patients should ask of the facility and of the practitioners. Please go right ahead.
Yes, when you're going and you will be getting a Botox, that is a medication. And so in order to get a medication, you have to be evaluated by a physician, an APN or a PA. You want to ask the question, who will be giving me the injections? The only people in Nevada who can give injections besides a physician, an APN or a PA, is an RN, an LPN, or a medical assistant. And many of the individuals who are working in these med spas are medical assistants, and they actually do work under the physician's license. So when set up properly and when the physician is on site, medical assistants are very capable of doing injections, for instance, of Botox or something else. But that depends, being able to get that medication depends on the physician doing the initial evaluation and prescribing the medication. And so you want to ask, number one, who is doing that evaluation and who is then prescribing the medication, and then who's doing the injection.
Yeah. And then the answer should be it's the physician that's doing the assessment and the diagnosis, and it's someone who's licensed or trained to do this, like would you say a nurse practitioner, or a medical assistant?
Yes.
Did you say?
Yes.
Okay. Is there anything else that you wanted to say about this whole procedure, like the legal issues around assessment and diagnosis and prescribing, Deborah? Do you feel like we've kind of covered that okay for now?
I think we've covered it.
Okay.
Yeah.
You know, another question that we wanted to touch on then is about how do people make sure that they're getting safe treatment?
Yeah. Well, let me just tell you a couple of things that you really need to remember. Medical cosmetic procedures do not happen out of someone's kitchen. They don't happen out of, if you have someone who says, I have a laser hair removal device in the back of my car and I'm willing to bring it into your kitchen, and I talk about these things because we've heard that these are things that happen. Or Botox parties. That's not someplace where you want to get, injections of Botox. So it's really important to look at what the basis is for the med spa. And as I spoke earlier, many times these med spas are part of a physician's practice. And that is a really safe place to start out, because that physician then will be there and will be supervising what's going on. APNs, advanced practice nurses or PAs, are very well equipped as long as they have that advanced certification to do cosmetic procedures, to work hand in hand with a physician and with other providers in a physician's office. That would be a safe place.
Okay. Now, again, I don't know if you can, how deeply you can discuss this, but nationally or even here in Nevada, what have been some of the harmful things that have happened to people, or what are the negative ramifications where people have gone to unsafe places? Deborah, can you discuss that in general?
Yeah, we've had some people who, for instance, have not been evaluated by anyone who has the authority to do that initial exam, And so they have been given medications that they have had bad reactions to. For instance, when you have an injection in your lips to make your lips fuller, usually they'll instill lidocaine or something into your lips, and people have had bad reactions to that, to the point where they had difficulty breathing. We've had people who have gone in for laser hair removal, and lasers are very, very hot pieces of equipment, and they have had third-degree burns on their legs because they were wanting to get hair removed from their legs. So we've had some really, really dangerous reactions from patients.
Yeah. So even though these procedures are so much more widespread than they were a generation ago, they still are medical procedures that need to be, there needs to be appropriate monitoring and supervision and appropriate training.
Absolutely.
Yeah. You know, we have about a minute in this segment. I was wondering, Deborah, what is your perspective about ordering some of these pharmaceuticals online?
Well, you know, you can get these things online, but what I'd like to make sure is that people are very cautious about that. And what I heard just recently on NPR that 50% of the pharmaceuticals that are available online, at least this is what they were saying, is that those pharmaceuticals are either not what they are saying they are, or they are
there's no quality assurance in terms of
they're not good drugs, and so definitely don't order those drugs. Make sure that you work with a reputable pharmacy to get those medications, and make sure that the people where you're getting treated go through very reputable drug people.
Good, excellent information, and right after this brief break, we'll continue our discussion. Hello, and welcome back to New Skills for Living. We're talking with Deborah Scott, the Executive Director of the Nevada State Board of Nursing. So, Deborah, could you tell us a little bit more then about this expanding business here in Nevada and nationally, and what the concerns are of the Nevada State Board of Nursing with this evolving industry?
You know, there are approximately 6,500 med spas across the United States. And going on the web, I was able to find at least 40 in Nevada. And I know that, you know, Las Vegas is the glamorous hub. And so people look to Las Vegas. And so I believe that it's going to grow more and more. And what we found in the Board of Nursing is that generally regulation lags behind what's actually going on out in the public and with consumers of health care. And so I think what I would really like to encourage people to do is to be involved in the development of that regulation so that patients can be made safe. You know, this industry is only expanding. Women and men spend billions of dollars a year in the United States on cosmetic surgery. And these preliminary kind of cosmetic procedures that we're seeing being done by sometimes incompetent people are dangerous. And so being involved in setting forth the regulations that will govern this type of practice is good, because it's going to be out there, so we need to make sure that people are safe.
Is there an evolving wisdom in our state, or are there models in other states about what type of legislation would provide a safe environment for these procedures, Deborah?
Well, possibly oversight. For instance, you know that there are, medical facilities are licensed by the Bureau of Healthcare Quality and Compliance. The individuals that are licensed in hospitals are licensed by regulatory boards, professional regulatory boards in Nevada. And those laws keep people who are incompetent or untrained, keep them out of the process of being able to meet the consumer needs that are being filled. And so it's really important that we make sure that we regulate so that we can keep people safe.
And then I'm wondering, as you were talking, I was wondering about we hear more and more about younger people, teenagers and even younger,
Yes.
like preteens who are having cosmetic surgery. I guess that's something that might be included in regulation or certainly should be supervised. What are your thoughts on that?
Well, I think that the younger individuals, there's so much going on, and it's about our culture, and it's about what is the ideal out there. And so part of what we need to do is make sure that there's parental guidance that goes on for these young people. And that's part of regulation.
Uh-huh. Would you think that it would be good for people to be counseled in advance about the benefits and the consequences and the pros and the cons? And I know sometimes with weight loss surgery they have to make sure that people are counseled in advance.
Yeah, I really think it's important for people to do their due diligence. And some of the things that, I mean, just in doing preparation for our interview today, there is just myriad of information out there, and so websites, going on, looking up cosmetic procedures, looking on websites as far as physicians who do those kind of things, looking whether or not physicians have been disciplined or nurses have been disciplined for doing cosmetic procedures that may be outside of the scope of practice. So I think it's important to be informed, and I think to have really realistic expectations of what the outcome would be.
Yes, realistic expectations, very important. Huh?
Yeah, and one of the things that we find is that people go into these situations having expectations that are really unrealistic.
Okay.
And so those questions are important when you go in to be evaluated, is to ask those type of questions. What can I really expect, and how many times will this take?
Okay, that's excellent information, and you'll see up on the screen is the website, easeap.com, where if you'd like to watch Deborah's interview or let someone else know about it, it'll be up on the website. Deborah, thank you so much for coming and sharing your wisdom and your expertise with us this week.
You're welcome.
It was
Thank
a real
you.
pleasure. Thank you.